All right, welcome to tonight's call. We have a very special guest tonight, Dr. Jennifer Rankin. She's going to be talking to us about the oral systemic health connection and that the fact that your body really is, your mouth is really the window into the rest of the health of your body. And Dr. Rankin is a graduate of the University of Iowa School of Dentistry. She met her husband and business partner, Dr. Mike Mingle, in dental school, and together they own their dental practice. After graduation, she and her husband served in the U.S. Navy, providing dental care to service members. And then following her service, she returned to Colorado, and that's when they opened the Rankin Mingle Dentistry, and they've been in practice for over 20 years. She is also a member of the American Academy of Oral and Systemic Health, the American Academy of Facial Aesthetics, and has advanced training in dental sleep medicine. She has also been chosen, this is a huge honor, as one of the top dentists in Denver's 5280 magazine for several years. And Dr. Rankin has a passion for health and nutrition as a certified health coach through the Dr. Sears Wellness Institute. She's also able to help her patients better understand the connection between oral and systemic health. By the way, she also has two lovely children who are now not so children. They're all both college bound, and 3 dogs. And her hobbies include traveling with her family, fitness, cooking, and spending time on the water. So welcome, Jennifer Rankin.
All right, thank you, Reagan, so very much. I'm excited to be here tonight and just share some of my passion as oral and systemic health and how that all ties into dentistry as my career. So with that, let's go ahead and get started. As Reagan said, and I'm sure many of you have heard this phrase before, but the mouth is the window to the body. And inflammation leads to gingivitis, periodontitis, and a variety of other systemic infections. So believe it or not, 75% of Americans have some form of periodontal disease. So anytime that the gums are bleeding, red, sore, sometimes just bleeding and red, those are early signs of periodontitis, which many of you have heard as gingivitis. But with periodontal disease, we're nearly doubling the risk of heart attack. It's a red flag for stroke danger. It increases diabetes risk, worsens our insulin resistance, and for a diabetic who is poorly controlled, it increases their threat of developing periodontal disease and vice versa. And one study showed that when you're looking at tooth decay and heart attack risk, that people that were in the throes of their heart attack and they looked at the plaques, the clots that came out, 75% of the clots actually had oral pathogens that cause tooth decay. And 35% of those clots contain bacteria that cause periodontal disease. So it's suggesting that about 50% of heart attacks may be triggered by oral pathogens. And one thing we do in our office is something called an oral salivary test. And these tests are a simple 30-second swish, and this allows us to look at a variety of things. We can order just one specific test or a variety, but we can look at inflammatory markers, periodontal pathogens, drug mapping, HPV, oral candida, and many, many more things. So this helps drive our treatment as well, because if I'm dealing with somebody who's got periodontal disease and their inflammatory factors are higher, I may choose a different treatment path than someone who doesn't have a multifactorial reason for their disease. So switching gears a little bit, and we'll tie back into dental, but only 12% of Americans exercise regularly, eat the recommended amount of fruits and veggies, and practice good oral hygiene, meaning brushing twice a day and flossing at least once a day. So what are some things that we can do, that you could do at home, or that we can suggest if we're talking to friends and family, is exercising regularly, 5 times a week for 30 minutes at a time, avoiding inflammatory foods, brushing twice a day, flossing once a day. Consider using an electric toothbrush or perhaps even a water pick. Scheduling regular dental hygiene appointments as recommended by your oral health provider. And again, knowing that about 12% of people actually have good oral hygiene or do the recommended procedures each day, even more important to see why you should come in and see your dentist. Ideally, we want to sleep 8 hours a day, reduce our stress, drink at least half our body weight in water, And finally, eat 7 to 13 servings of fruits and vegetables every day. And as many of you on this call know, that we don't see that very often. We don't see people that are actually getting those 7 to 13 servings, and it's very difficult to do. And another thing I want to point out is between the slide before and this slide, these are all things that we talk about in our Shred 10 program. So for anyone on this call that hasn't heard about Shred 10 or is wondering about Shred 10, definitely talk to the person that invited you onto the call because they can explain more. But what I love about that is those Shred 10 guidelines apply all around the board. So I'm doing a talk on dental, but guess what? All those things affect your dental health, your stress, your inflammatory foods, all of those things, they all go together. So the Shred 10 guidelines are just really lifestyle guidelines. So let's get back to fruits and veggies. Why 7 to 13? Why do we need these fruits and veggies? Well, they're anti-inflammatory. They provide antioxidants to combat those over 10,000 oxidative hits that our cells are exposed to every single day. And oxidative stress contributes to disease and aging along with inflammation. So what I love about Juice Plus is it offers a simple solution, right? It bridges the gap between what we should be eating and what we're able to eat. It's the nutritional essence of over 30 different fruits and veggies in a capsule or soft chewable form. It is vegan, dairy-free, gluten-free, and non-GMO. And it's NSF third-party certified to be free of contaminants. Well-researched, and it's safe for everyone. And I think that is one of the things I love most about Juice Plus, right? Is that I can be recommending something that not only is well-researched, but it's safe for everyone. Kids, adults, pregnant women, athletes, we all need fruits and veggies, and that's never going to change. And just as a pictorial, I know you can't read this, but this is just what's in an apple. So think about over 30 different fruits and veggies that are going into your body. You're getting all of this times 30, right? You could never replace what is in food and what's in the synergy of food with a multivitamin. And as I touched on the research, again, over 35 independent published peer-reviewed studies on the product, showing us that this Juice Plus gets into our body, right? It's bioavailable, it gets into our body and it does something. It reduces our inflammation, reduces our oxidative stress, maintains our healthy DNA, balances the immune system, improves pulmonary function, skin health and hydration, improves quality of life in ovarian cancer survivors. And again, I would say just quality of life in many of us, and improves gum health. And our dental study, we've actually had 2, actually shows that Juice Plus supports a healthy teeth and gums and also healthy recovery after third molars are removed. So that improves your quality of life as well. So if we combine our Juice Plus with our standard care, when we're doing standard care of cleaning and periodontal procedures, we're going to improve our results that we're getting with our patients. And I have seen that firsthand. In fact, many of my customers who started out when I very first started with Juice Plus still continue to take Juice Plus today because they've seen the difference. And I love also that we have our plant-based omegas to add into our baseline fruit, vegetable, and berry blend. Again, this is all plant-based, so we're skipping that middle fish and jumping right past that and getting our plant-based omegas. And if you like growing your own food, this is simple, easy, and environmentally friendly. So we can grow our own food, get more of those antioxidant-rich fruits and veggies into our diet to ultimately help our health overall and our dental health overall. And finally, for those of us who are just busy on the go or just looking for something simple, delicious, plant-based, and easy, our complete shakes. I mean, I eat one every single day, love it. My family loves it. My kids who are both in college, they love the complete as well. It's just a great thing to have in your back pocket. So as Richard Du Bois, infectious disease specialist, he stated that there is no other product with or without a prescription that can do what Juice Plus does. And again, as a medical professional, as a dentist, I love the fact that I have something that is simple, that everybody can use, and that is backed by research. And that makes it simple, easy, and I know the changes that happen. So with that, I'm gonna say, you know, I don't have anything else to add to that. I hope that you'll take take the opportunity to get your questions answered. Speak with the person who invited you on this call. If I can be of help to you, please feel free to reach out to me as well. I'd be happy to answer some other questions as they may relate to your dental health or what your dentist thinks or other questions you have. So that's it for me. Thank you.
Thank you, Jen.
Yeah, you bet. Thanks, Reagan, for having me on.
Yes, thank you. And I love that, the whole mouth health, obviously we put food in our mouth so that our body can be healthy. So it makes sense that that nutrition affects your dental health as well. So super important topic. So thank you.
You bet. Absolutely.